Thank you all so much for coming to our 2024 Black Maternal Health Caucus Stakeholder Summit. We are so excited to have you all here and looking forward to the wonderful discussions and conversations and engagements that we will have today. My name is Brittany Hughes, and I serve as Congresswoman Underwood's Legislative Director. I will also be serving as your MC today. So when you see me up here, just be aware that something important hopefully is about to be said. It's such an honor to be participating in this summit, and I do regret to share that Congresswoman Underwood is not able to join us today in person, but I do want to convey to you all that it has truly been a pleasure and a blessing for me serving in her office and seeing the advocacy and the hard work that she does on this issue every single day. Her work on the Momnibus, her work as co-founder and co-chair of the Black Maternal Health Caucus can't be understated, in partnership with Congresswoman Alma Adams as well. So we will begin today with a few opening remarks, starting with those from Congresswoman Underwood, who is the reason that many of us are here today and have come together. And so I will direct you all to the screen for that.
Good morning, everyone. For those of you who I've not met yet, my name is Congresswoman Lauren Underwood, and I'm the co-founder and co-chair of the Black Maternal Health Caucus. And I am delighted to welcome all of you to the 2024 Black Maternal Health Caucus Stakeholder Summit. I am so sad that I can't join you today because I'm sick. And it is such a bummer, especially because this is the first time that we're hosting the summit in my home state, and I could not be more excited. Thank you all for joining us today. And for those in the room, I hope you enjoy your time in our community, the beautiful 14th Congressional District. To our local and state partners, thank you for making today possible. It means so much to me and every member of our caucus to have all of you here partnering with us in this fight to end our nation's maternal health crisis. I'd like to shout out my co-chair of the Black Maternal Health Caucus, my sister and my friend, Congresswoman Alma Adams. Representative Adams is unable to join us today, but we are so thrilled to have her with us virtually, and I could not ask for a better partner in this work. I also want to acknowledge our Senate lead on the Momnibus, Senator Cory Booker, who continues to be a tremendous champion for our work. I want to thank all members of the Black Maternal Health Caucus who have committed themselves to elevating the maternal health crisis and taking action to end it. And finally, I'd like to thank the Biden-Harris administration. There has never been an administration more dedicated to maternal health, and we are thankful for the leadership of Vice President Kamala Harris, President Joe Biden, and others throughout the executive branch, some of who you will hear from later today. Now, as we prepare for a full day of panels and breakout sessions and opportunities to connect and celebrate with each other, I can't help but reflect on the journey we've been on together, the overwhelming progress we've made, and the work ahead. Friends, let me tell you, there is work to do because despite the incredible progress that we've made, we are still living through a maternal health crisis in America. The United States has the highest maternal mortality rate of any high-income country. This is a crisis that affects every mom and family in our country, and Americans in the suburbs, in rural communities, and urban areas all have a story to tell about how it has touched them. And it's getting worse. The maternal death rate is 89% higher than before the pandemic, and disparities have gotten worse too. It's devastating and it's tragic, and moms across America are demanding a comprehensive solution. For many of us, this crisis isn't just about data, it's personal. For me, it was my friend Shalon Irving who lit the spark. I enrolled at Johns Hopkins University in 2008 as a 21-year-old, fresh after finishing up my undergraduate studies. Right away, I found myself intimidated during orientation by my classmates who had incredible credentials. But I made two friends that first day of class. Shalon, who had already completed a dual doctorate in sociology and gerontology, and Reagan, who was a practicing OBGYN. Shalon was warm and friendly and made me feel completely at ease. We were fast friends. 9 years later, in 2017, as I wrapped up my service in the Obama administration, Shalon gave birth to a baby girl named Soleil. But a few days after giving birth, Shalon began showing signs of serious postpartum complications. She went to the doctor 3 times during what turned out to be the last week of her life. Shalon died of a preventable pregnancy-related complication, and her death was devastating. Ms. Wanda Irving, Shalon's forever mother, is here with us today. She has become an incredible advocate in honor of Shalon. Ms. Wanda, thank you for joining us and allowing me to be a partner in honoring her legacy. Like Ms. Wanda, too many of us have our own maternal health stories of loss and near misses and tragedies that could have and should have been prevented. We know that the only way to end this crisis is to pass a comprehensive solution. So, 5 years ago, Congresswoman Alma Adams and I launched the Black Maternal Health Caucus. Now, when we first started the caucus, we thought it would just be the 2 of us. We wanted to work on this issue, so we started a caucus and we gave ourselves a name because that's how Congress works. And then with 53 founding members, we created the Black Maternal Health Caucus to organize around the goals of elevating the Black maternal health crisis and advancing policy solutions to improve maternal health outcomes for all moms. We hosted the first ever Black Maternal Health Caucus Stakeholder Summit back in 2019 in a crammed room in the basement of the Capitol. Some of you were there, and you remember the excitement in the room. Since then, we've grown into one of the largest bipartisan caucuses on Capitol Hill with over 110 members across the House and Senate. And now we've taken the Black Maternal Health Caucus Stakeholder Summit on the road, and we're in my district right here in Illinois. We are so proud of how far we've come, and we remain committed to advancing the comprehensive solution to our maternal health crisis. It's called the Momnibus Act. The Momnibus is a comprehensive package of 13 evidence-based bills that address every driver of maternal mortality, morbidity, and disparities in the United States. And when I say comprehensive, I mean comprehensive. The Momnibus includes investments to grow and diversify the perinatal workforce, to improve data collection, to expand access to housing, and nutrition, and healthy environments before and after pregnancy. The Momnibus will support moms with mental health conditions and substance use disorders, and the Momnibus makes investments directly and specifically into community-based organizations, providing historic levels of funding that would allow orgs like yours to continue your life-saving work and spread the models you've developed to every community across the United States. The Momnibus is designed to solve America's maternal health crisis. And I am so glad to say that my colleagues in Congress are recognizing that. Last year, when we introduced the Momnibus for this Congress, we did so with more than 200 original co-sponsors between the House and the Senate. We have made incredible progress in moving the Momnibus forward and saving moms' lives. We passed the first Momnibus bill into law, the Protecting Moms Who Served Act. This bipartisan legislation invests in world-class maternity care for our veterans. I was so excited to go to the White House and see President Biden sign this bill into law. It was a moment that reflected years of hard work and advocacy from so many people in this room. Since then, we've introduced a successor bill to this law. It's called the Maternal Health for Veterans Act. Now, earlier this year, the House Veterans Affairs Committee held a hearing on that bill, and I was honored to testify in support. And it's not just in the House. Just a few months ago, the Senate Health Committee held their first hearing on the maternal health crisis, where Chairman Bernie Sanders and other senators called on Congress to pass the Momnibus. But that's not all. For the 5th year in a row, the Black Maternal Health Caucus has secured significant federal resources to address our maternal health crisis and save moms' lives. In the 2024 federal funding package that the President signed this spring, the Black Maternal Health Caucus secured more than $100 million. Let me say that again, $100 million in funding for Momnibus priorities. That's on top of more than $100 million we secured last year. These appropriations wins include one of the only direct streams of federal funding for community-based organizations to deliver maternal health support services, as well as funding for HBCUs and minority-serving institutions to study maternal health disparities, and significant investments in improving outcomes for moms in rural communities. Inside the folders you were given, you can find a complete breakdown of how this funding and how it's serving moms and families across our country. Now, we're going to talk a lot about this today, so I'm not going to spend a lot of time on it right now at the beginning, but one thing I really want you to know about this money is that you have to apply for it. I want you to hear me say, we've secured the funding, but now stakeholders, researchers, community orgs, and state and local governments need to go and get it. Those dollars are for us, but we need to do the work. A couple of the breakout sessions today are going to show you exactly how to do that. Now, since 2019, the caucus has also worked tirelessly to secure more focused and robustly funded maternal health research. In our first year, we met with Dr. Francis Collins, the National Institutes of Health Director, and explained the need for this research, and he got it. After that meeting, NIH pulled together the IMPROVE initiative. It stands for Implementing a Maternal Health and Pregnancy Outcomes Vision for Everyone. And because of our work, right now, NIH IMPROVE is supporting the critical life-saving research that's being done at universities and institutions around the country that's improving outcomes and saving moms' lives. NIH IMPROVE places special emphasis on health disparities and populations that are disproportionately impacted by this crisis. And we have made it possible for all of these institutions to work together. 5 years later, we've increased funding for NIH IMPROVE fivefold, and we are working to advance bipartisan legislation to make this funding permanent with Senators LaFonza Butler and Katie Britt. I am so proud of the progress we've made in moving the Momnibus forward, but there is more work to do. Congress must pass the Momnibus now. The Momnibus is not a Band-Aid, it's not a messaging bill, it's not a commemorative resolution, and it is not a study. It is the comprehensive solution to end preventable maternal death across the United States. It invests in us, in our families, and our future. And as I think about everyone gathered here today, I've never been more confident that we can do the work that's needed to save our moms, to end these disparities, and provide every growing family with the care and support they need and deserve. We have the solution, and with the willpower and energy of the folks in this room, together with the incredible partnership of Vice President Kamala Harris, we are going to pass the Momnibus. So thank you for joining us here today and for joining us in this important work. We're going to do a lot of celebrating today, but friends, today is a work day. I hope you enjoy everything that we have planned. Learning about the stories that motivate us to take action, the federal initiatives to improve maternal health, how you can get Momnibus funding directly into your orgs and your communities, and much more. Now, up next, I'll turn it over to Representative Adams, my fellow co-founder and co-chair of the Black Maternal Health Caucus, for her welcome remarks.
I'm Congresswoman Alma Adams, and I am so pleased to have you here for this year's Black Maternal Health Caucus Stakeholder Summit. I bring greetings from the 700,000 citizens of the 12th Congressional District of North Carolina, the over 100 members of the Black Maternal Health Caucus, and the Congressional Black Caucus Chair Stephen Horsford, and the 60 members of the CBC. This year marks the 5th anniversary of the founding of the Black Maternal Health Caucus. It's been a pleasure working alongside my sister, Congresswoman Lauren Underwood, as co-founders and co-chairs of the caucus. Thank you to all the stakeholders that have gathered today under the collective mission to improve maternal health outcomes in our country. None of this success would have been possible without your leadership and community building. With input from many of you here, Congresswoman Underwood and I developed the Black Maternal Health Momnibus Act, a package of 13 bills that unequivocally says that Black mamas matter. Our first bill from the Momnibus, the Protecting Moms Who Served Act, has passed into law. Several priorities in the Momnibus have also already been adopted by the Biden-Harris administration. This administration has invested over $200 million to support these priorities, dollars that have gone to supporting our perinatal workforce and to uplift the work being done by community organizations like many of the ones represented here today. This summit is an opportunity to recenter us in our goals and find community and inspiration in each other. There are some brilliant speakers here today that will share insights on the many facets of the Black maternal health crisis and the innovative work that they're doing to push our nation forward. I do my work in honor of my daughter, Janelle, who almost became a victim of this crisis. Janelle is my daughter, a sister, and a mother to two amazing children, and she's also a part of her community. She currently serves as a coordinator for Guilford County Schools to connect children experiencing homelessness to the resources and community support they need to succeed. She's someone who weaves the threads of so many lives together into the fabric of her community. And I think about what happens when we pull out the threads of all of the mothers we lose every year in this country. I know for many of you, this issue is a deeply personal one. And so I hope that this summit leaves you energized and with a sense of community and hope for ourselves and for our future generations. We're dedicated to putting in the work for meaningful change and sowing the seeds today for the generations of tomorrow. Because somebody once said that a community can only grow great when old men and old women plant trees under which they know they will never sit. So there's so much more to do, and I'm proud to join you in continuing that fight because our mamas can't wait. Thank you. God bless.
Such powerful words from Congresswoman Underwood and Congresswoman Alma Adams. Are you all feeling their enthusiasm? It's contagious, even virtually. We will have a few more opening remarks, starting with Senator LaFonza Butler. Senator Butler has been an amazing partner for our office as we've worked to advance maternal health. She co-leads the Senate version of the NIH Improve Act, which, as Congresswoman Underwood has underscored, is one of the keystone pieces of legislation to help in funding research in maternal health, especially for Black women. I will go to remarks from Senator LaFonza Butler.
Good morning, everyone. It's an honor to address you all today for this year's Stakeholder Summit. I want to express my deepest thanks and congratulations to Representatives Underwood and Adams for organizing this incredible event. I am proud to partner with these remarkable women and so many others in this room who recognize the urgent need to pass comprehensive legislation that tackles the serious problems Black mothers face in our country. This is an issue that is near and dear to my heart. As the only Black woman to currently serve in the United States Senate, I've heard the stories of women who've been unfairly denied the kind of culturally sensitive, high-quality care that they deserve. And as a mother to a 9-year-old little girl, it breaks my heart to see how the worsening maternal health crisis devastates families all over our country. It pains me to know that Black mothers who make valuable contributions each and every day and serve as a driving force of our economy are overwhelmed due to the lack of healthcare options. It's unacceptable that 80% of Black mothers are the breadwinners for their families, yet the healthcare system continues to fail them. It's unacceptable that the U.S. leads as a developed, high-income nation, yet has the highest maternal mortality rates amongst its peers. And it's unacceptable, sisters, that Black women, while we make up 15% of the US population, our maternal mortality rates are 2 to 4 times higher compared to our white counterparts. Now, I draw these contrasts to underscore the grim future that we continue to face. while also to highlight why exactly I needed to address these challenges head on. Earlier this year, I introduced the NIH Improve Act alongside Senator Britt and Representatives Underwood and Fitzpatrick in the House to help address some of these disparities. This legislation authorizes the funding necessary to support the National Institute of Health's Improve initiatives, research on how to reduce preventable causes of maternal death, improve health for women before, during, and after pregnancy. And on top of that, the bill would provide steady funding for the next 7 years to make sure that the NIH can continue to pursue research into the root causes of our maternal mortality crisis and also build the evidence to ensure that we continue to have an evidence base to improve maternal health care in underserved areas. Now, I'm proud of this bill. I'm proud to work alongside fierce champions such as Congresswoman Adams and Underwood.
Hello, everyone. I am Monica Bertagnoli, Director of the National Institutes of Health. Thank you for the invitation to speak to you today on an issue of such importance to our nation's future. As part of our mission to improve the health of the nation, NIH is committed to investing in research to understand and reduce maternal morbidity and mortality, and to address the shocking disparities in maternal health among Black women. Americans hold an unfortunate distinction. Pregnancy-related deaths are higher in the United States than in any other high-income country. Many of these deaths occur in the year after delivery of an infant, and 4 of 5 deaths are preventable. Maternal health outcomes vary by age and ethnic group, by race, education, socioeconomic status, and geographic region. Black women are about 3 times more likely than white women to die from a pregnancy-related cause, regardless of income or education level. And many pregnant people in our country report being discriminated against or not heard by their healthcare provider. One pregnancy-related death is far too many, and research is critical to identify outcomes that can lower maternal mortality and are responsive to the needs of women. NIH has collaborated closely with the Black Maternal Health Caucus to advance community-driven, evidence-based solutions aimed at reducing maternal deaths and improving health for women before, during, and after delivery. With support from the caucus, NIH established the Improve initiative in 2019 to address the maternal health crisis. Improve stands for Implementing a Maternal Health and Pregnancy Outcomes Vision for Everyone. As part of the initiative, last year and this year, NIH has funded 12 maternal health research centers of excellence. These centers are working to design and implement culturally appropriate research projects across the U.S. that address the biological, environmental, and structural factors that can lead to pregnancy-related complication and death. The breadth of science of the centers is impressive. They are evaluating approaches like integrating community health workers, including doulas, and applying artificial intelligence and machine learning to electronic health records. They are addressing conditions ranging from anemia and preeclampsia to substance abuse disorder and mood and anxiety disorders. And they are assessing the impact of social determinants of health, like housing instability, violence, access to care, nutrition, and food insecurity. In short, they are charged with addressing all of the complicated variables that contribute to poor survival for women. At NIH, we understand that strong community engagement in research is essential to addressing the priorities of diverse and disproportionately affected groups in our country. Through partnerships with community organizations and others, the improved centers of excellence are generating the scientific evidence we need to guide clinical care and reduce health disparities during and after pregnancy. And they are helping to ensure that scientific findings can be translated into clinical practice. We are hopeful that ongoing research funded by the NIH Improve Initiative will have a profound impact on maternal care delivery, especially for groups with high disparities in maternal health outcomes. At NIH, we are mindful that we need to support a comprehensive life course approach to addressing maternal health, recognizing that pregnancy and birth should not be isolated from other aspects of a woman's overall health. But pregnancy can be viewed as a stress test and a potential warning sign for future health risks, such as high blood pressure, diabetes, and maternal health conditions. We need to understand the interactions among the risk factors and the protective factors that can shape health outcomes beyond pregnancy. And our efforts extend to the child that is born as well. Postpartum care is a crucial area of focus for the Improve Initiative. While the Improve Initiative is an enormously important effort, NIH is also engaged in other work to support the infrastructure and capabilities needed to conduct maternal health research in a wide range of communities. We even have a prize competition to speed the development of technologies that can improve maternal health outcomes in so-called maternity care deserts, which include urban and rural areas across the country. There is so much work to do, and NIH is fully committed to supporting research to reduce health disparities, help those at risk, and improve the health of all women across the nation. Thank you.
For our final opening remarks, I would like to share that we will have here with us in person State Senator Lakeisha Collins, who I have been told is a lifelong Chicagoan and is also such a vital and necessary voice in the community here in Illinois. She is an advocate as well as a mother of three, and Senator Collins, I would like to invite you up now.
Good morning. Oh, come on now. Good morning. It's early, I understand. I just drove an hour here from Chicago, but I am so honored to be here today, and I want to thank Congresswoman Lauren Underwood for inviting me here to speak on the work that we've been doing here in Illinois around maternal health. I think this is a very important issue, and I see so many familiar faces in the room. But I want to also thank our Lieutenant Governor, Juliana Stratton, because this would not be possible had it not been for her advocacy and sitting and meeting with leaders like Janine Valerie Logan and her partners who pretty much led the discussion around why it was important to have legislation to break down the barriers that a lot of African American women are facing. And so how did we get here? It started there. But we all know that the history of Black midwives were known to be the primary providers of prenatal birth care across the country. They were considered to be pillars of their communities. And over time, because of the assault on the practice of midwifery by white physicians, it drove down the numbers of midwives, which worsened the birth and pregnancy outcomes for Black women. They were affordable back then. They built the community trust. They were family to most, and they created a safe, nourishing environment. When the decline happened, it forced Black women to seek care from discriminatory institutions, resulting in increased infant mortality and morbidity rates. I'm raising 3 healthy Black sons on the near north side of Chicago. I say they are my Black boy joys because they are. They are a gift. Thank you. And I had access to a midwife and a doula. And also I breastfed, believe it or not, I did, all 3 of my boys. And they're healthy. And I may not have had the same exact experience as our ancestors by birthing them in a home, but I did have access to essential information to properly care for my sons and the importance of breastfeeding and also postpartum care. But that wasn't the case for many African American women. What we do know is that Black women are 3 times more likely to die from pregnancy-related complications than white women. And we also know that there are multiple factors that contribute to these disparities, such as the variation in quality health care, underlying chronic conditions, structural racism, transportation, lack of transportation, and implicit bias. Couple that with an underlying undersupply of maternity providers, especially midwives, Black, brown midwives, and a lack of access to postpartum and maternity care coverage. We also know that when Black women seek care, they experience a lower quality of care, which adds more to their complications. A mother should never have to choose between her life or giving birth to her child. No woman should ever be brushed aside and told that it's all in your mind when they're seeking answers to changes in their bodies. But this happens way too often with Black women. I know this from experience too. This is why I had the honor of sponsoring House Bill 5142, which is the Birth Equity Initiative, which was signed into law last month by our Governor, J.B. Pritzker. Y'all should be clapping for that now. That was a big thing. This bill would do the following. It mandates that private insurers will be required to cover all pregnancy, postpartum, and newborn care provided by prenatal doulas, licensed certified midwives, including home births, home visits, and support during labor and aftercare. Insurance companies will need to cover home visits by board-certified lactation consultants, including the cost of breast pumps, breastfeeding supplies, and feeding aids. Includes over $10 million in funding to identify and address gaps in funding programs that can reduce adverse maternal health outcomes. It also includes $5 million to expand the Illinois Department of Human Services home visiting program and funding to a $1 million pilot diaper equity program. The Birth Equity Initiative also includes dollars for existing clinics under the Illinois Reproductive Health Facilities Capital Grant, targeted towards birth centers that provide pregnancy services in underserved communities in areas that have seen an influx in patients in the aftermath of the Dobbs decision. This law will also provide coverage for abortion care without cost-sharing limitations, like waiting periods or deductibles, and add coverage for certified professional midwife services for residents with Medicare starting January 1 of 2025. Lastly, to keep consumer costs from inflating, the law allows policy limits to cover up to $8,000 for home visits by prenatal doulas. That was a lot, but sometimes my mouth is dry, so I'll be like, But we have a lot more work to do. We have a lot more work to do. Midwives and doulas come hand in hand, right? And we need more representation in our communities. And so this bill covers you, whether you're in the urban area, all the way down to the rural communities, no matter what your economic status is, what race you are, women will have access to good maternal health care. And as I said before, from my personal lived experience, I've experienced too many times where I've went to a health professional who did not look like me and told me it was all in my head, that you're not at that age limit right now. But I've seen too many women in my age range, which I would not say that right here. No, I'm a millennial. And on the higher end, I just found out what CAP means, okay? So sad, but there are too many young women dying from all types of health complications that could be preventable. And to know that 80% of these cases could have been preventable, it is horrifying, it's disheartening. And so I'm glad that we were able to get this accomplished in Illinois, but it would never have happened if we didn't have the advocates, the people with the lived experience, and the leadership of our Lieutenant Governor, who really made sure that they had the right people leading on these bills, and Democrats in Illinois voting yes to make sure they put moms and babies first. So thank you all for having me. I can't stay the entire event, but thank you so much. Love you all. And lastly, I am starstruck. I saw you over there, Mr. Ali. I love you, girl. All right, y'all have a good day.
Thank you so much to all of the federal and state leaders who have joined us this morning and shared these inspiring remarks. Y'all, can we just give them a round of applause?